Hello everyone and welcome to Rare à l'écoute, the podcast channel dedicated to rare diseases. Today we continue to explore Cushing syndrome, and to talk about it we are pleased to welcome Mrs. Fournier, who is concerned by this rare disease and also an active member of the Surrénales Association, the French Patient Association for Adrenal Diseases. Mrs. Fournier, good morning.
Good morning.
So Mrs. Fournier, my first question is quite simple. When and how did your first symptoms occur?
So the first symptoms occurred in 2011. I was 30 years old. At first, it was palpitations, headaches, dizziness, bruises on my legs, and acne. And soon in 2012, I had my first miscarriage. In total, I had 3 miscarriages with sizable weight gain, a fracture, and the onset of a depression, which was explained by the medical team as a consequence of my miscarriage. And then a lot of anguish, a lot of stress to finally reach a weight that went from 60 to 107 kilograms. A lot of acne, amenorrhea, high blood pressure. In fact, I had the impression that my whole body was completely out of control. So I was taken care of by a doctor who very quickly referred me to psychiatrists because I had very strong anxieties. And regarding psychiatrists, as I said, I had the impression of having a brain tumor. They raised several diagnoses: hypochondria, delusional depression, psychosis. None of these diagnoses will be questioned afterwards. And so I was taken into psychiatric care and I was interned twice.
So a very complicated situation. How long did it last before you had the right diagnosis?
So this diagnostic wandering lasted from 2011 to 2018 for 7 years. I was followed, I counted, by 47 doctors, and in fact, each time the doctors went back to the psychiatric hypothesis and therefore did not consider all the symptoms. In the end, it was about putting me in a psychiatric institution and considering me as disabled, since I was explained that I would never recover, that I would never be able to work for the rest of my life. So eventually in 2018, in the end, I resigned myself to this status.
And eventually, how was the diagnosis of Cushing disease made?
So during my first illness, my parents took care of me. There were 8 years of diagnostic wandering, including 4 years living at my parents', as I broke up with my husband. And because when you have strong symptoms like I did, it's difficult to simply live, to pay your rent, to work. My parents took me in for 4 years, and they moved from Paris to Vendée near the Atlantic coast. And there I had to find a new general practitioner. And when this doctor saw me, she listened to me. It's like I had been mute for several years. As all I said was always misinterpreted, I had stopped saying anything. And when she saw me, she saw the weight gain. She asked me how much I used to weigh. She listened to me. She made me undress. She saw the huge stretch marks under my arms and all over my body. She saw the acne. She saw my red face in the middle of winter. She told me this was not normal and this was not the symptoms of depression. And going back to zero, when she put all these symptoms together, she just told me, I think you have Cushing disease. So she measured in emergency, and my cortisol level was indeed 12 times higher than normal. So cortisol is the hormone that manages stress, and that's the particularity of Cushing disease. In general, in this disease, it's multiplied by 3 or 4, but for me, it was multiplied by 12. So I was referred to the university hospital, which took care of me and was able to treat me, knowing that by this time, the disease had affected my immune system, so I had serious lung infection. So I was admitted urgently at the university hospital under oxygen.
And after all this time and know that Cushing syndrome is finally diagnosed and recognized, how are you today?
Cushing disease is in 75% of cases due to a benign tumor in the pituitary gland, and mine was removed by surgery. But it took 14 months almost to recover as my lungs were too affected. I was too weak, in fact, physically. A neurosurgeon removed a benign tumor that was in the pituitary gland, an adenoma. In fact, we call it a pituitary adenoma. After that, I wind off all the treatments I was taking, psychiatric treatments, and I lost weight very quickly. My cortisol level fell from a huge level to 0. It's been 2 years now I'm in remission. I'm still being followed as I still have some side effects of the operation and the disease. So after this long period of illness where I was completely isolated, I wanted to write a book, which is called Sunfish. a testimony on rare disease to explain my journey. I wanted to write it first for young doctors, and finally it had a little success. I think it was re-edited by a publisher. And just after the operation, I said to myself I wanted to write and sing again and to go back on stage since it was my job before the disease. I'm a singer and songwriter. So I worked, I wrote song, I prepared a concert, and I went back on stage. But it was on the very first day of lockdown, so I had to wait for a while. It started a little bit slowly, but anyways, I'm going back to my job. I'm preparing an album. The concert is ready. I'm living again. I'm completely living again. It's incredible. Life is wonderful when you're in good health.
So now, Mrs. Fournier, you are an active member of the Surrénales Association, the French Patient Association for Adrenal Diseases. Why did you choose to join the association?
When I wrote Sunfish, my book, I didn't feel like setting up an association. Everyone has their own thing, and my thing is to write. So I contacted the Surrénales Association, the two co-presidents, one of whom had already read my book, and we met and we decided to work together. My objective was to make the disease known, and I thought it was important that it be an association because I did not do it as a personal initiative. I'm not an isolated case. Cushing disease is one case out of 1 million people, but it is still a small number of people, and there's an average of 5 years in the diagnostic errancy. So there are many of us who live. It was very complicated period, so I joined the association. Today, I'm an active member, and my objective within the association as a volunteer is to set up concrete actions. So we are in the process of producing a booklet to explain the disease to internal doctors in hospitals. We're going to try to set up a working group to work on videos to explain the disease, to make it known as much as possible. We know that cortisol is part of the high school biology curriculum, so we're going to try to use this to communicate.
And from a more general point of view, Mrs. Fournier, what are the objectives of the association?
So the aim of the Surrénales Association is to support patients and to improve patient care by listening to them. That is to say, the association works with doctors and patients. The aim is to provide optimal care and to improve the quality of life. It's also important to know that it is these patient organizations that finance research into rare diseases, which is why it's so important to join in. The aim is obviously to make these rare diseases known. So the Association Surrénales groups together all the diseases that concern the adrenals, of which Cushing disease is one.
So we're coming to the end of our interview, Mrs. Fournier, and to conclude, if you had a take-home message, what would it be?
The message I would like to pass on is to make this disease known. So that is what you're doing, and I thank you very much for that. We realize that there are still many doctors who do not know about Cushing disease, and I think the first step is to know about it in order to diagnose it. The message I want to give to doctors is to listen to the patient, and to patients is to know that there are resources that are completely unexpected. I would like to thank my family who supported me throughout this ordeal, and thanks to whom I'm alive, and the doctors who treated me. We must realize that it can happen to anyone, that life is wonderful, so you must hold on for the patients and diagnose for the doctors.
Well, thank you very much, Mrs. Fournier, for your testimony. As for us, dear listeners, we thank you for your time, and we look forward to seeing you on our podcast channel, where you can find all our previous episodes on Cushing syndrome. See you soon.